Ever wondered what dental hygienists really make per hour in 2025? I mean, beyond the job boards and glossy promises, today we're pulling back the curtain. Dr. Esma is here, and trust me, some of these numbers might surprise you. Is it a comfortable living, or does the reality bite back? Stay with us, because the gap between expectations and real pay is bigger than most people think.
Exactly, Rasim. People hear one number online and assume it tells the whole story. But hourly pay can swing wildly depending on location, experience, schedule, and even the type of clinic. Some hygienists feel well rewarded, others feel stuck. In this video, we'll break down what really shapes those paychecks and why two hygienists can earn very different amounts for similar work.
So if you're a hygienist, a student, or just pay curious, don't blink. The most eye-opening part is coming up next. Let's paint a real picture. Imagine two hygienists with the same license, same skills. One feels comfortable, the other feels constantly behind. Dr. Esma, people keep asking, why does the pay feel so inconsistent? One month looks great, the next month feels tight, even though the hours look the same on paper.
That's because hourly pay is only part of the story, Rasim. Missed appointments, unpaid gaps, part-time schedules, and regional demand all change what ends up in your pocket. Many hygienists are shocked when they compare advertised rates with their real take-home experience. It's not deception, but it is incomplete information.
And that gap between expectation and reality is exactly what creates stress. Stick with us, because next we'll break down where the biggest surprises hide. Here's why this really matters. When people misunderstand pay, they make big life decisions on shaky ground. Dr. Esma, I've seen hygienists choose cities, clinics, even career paths based on one attractive hourly number, then feel blindsided months later.
Exactly, Rasim. I've worked with hygienists who earned less per hour but took home more overall because their schedules were stable and their clinics stayed busy. Others chased higher rates and ended up with unpredictable hours and stress. Understanding the real pay picture helps people plan smarter, negotiate better, and avoid burnout.
And that's the key. This isn't just about money, it's about control and peace of mind. Up next, we'll break down the numbers that actually matter. Alright, let's ground this with a quick snapshot. Dr. Esma, when people hear average pay numbers for 2025, they often imagine a smooth, predictable curve. But reality looks more like a roller coaster, right?
Very much so, Rasim. I've seen new hygienists start at a modest hourly rate but quickly stabilize with consistent bookings. At the same time, experienced hygienists with higher advertised rates sometimes lose hours due to cancellations or seasonal slowdowns. One small change in schedule can quietly shift real earnings over a year.
That's the part people rarely calculate. It's not just what you earn per hour, it's how many of those hours actually happen. And this background sets us up perfectly for the deeper breakdown coming next. Now, let's zoom out for a second. Dr. Esma, from a clinical and workforce perspective, why has hygienist pay become such a moving target in recent years? It feels less predictable than ever.
Great question, Rasim. From a science and systems angle, it's driven by supply, demand, and patient behavior. Preventive care demand keeps rising, but hygienist availability varies by region. When clinics can't fill chairs, hours drop. When schedules are full, earnings stabilize. Research consistently shows workload balance and appointment flow matter more to real income than headline hourly rates.
So look, the science says it's not just what you charge per hour, it's how the system around you behaves. And that insight changes how we should read every pay number we see. Alright, Dr. Esma, let's get practical. If a hygienist wants to turn a confusing pay rate into something predictable, what's the step-by-step playbook?
First, Rasim, track real hours, not advertised hours. Look at how many patients you actually see each week. Second, evaluate clinic flow. Are cancellations common or rare? Third, ask direct questions about schedule stability before committing anywhere. And finally, negotiate around consistency, not just the hourly number. A slightly lower rate with full days often wins long term.
That's a smart filter. When you follow those steps, the mystery fades and the numbers start making sense. Before people rush out chasing a shiny number, we should talk warnings. Dr. Esma, what are the biggest mistakes you see hygienists make when judging pay rates?
The biggest one, Rasim, is ignoring the fine print. Don't assume paid breaks, guaranteed hours, or consistent patient flow unless it's clearly discussed. Another mistake is comparing pay across cities without adjusting expectations. And finally, don't undervalue stability. A predictable schedule protects your energy and long-term health.
So the do's and don'ts are clear. Don't chase hype, do chase clarity. That mindset alone can save years of frustration.